Hello, everyone. This is Miss Kanyambo from Greatness Intuition Center, and today we're going to look at dehydration. So, dehydration is a very common sign that manifests in a lot of conditions. And for dehydration to occur, there is an imbalance between the fluid input and the fluid output. And we tend to supply the body with fluids through the food we eat and the fluids that we take in. And the body tends to get rid of water or excrete water through the kidneys, that is urination, through the GIT, that is vomiting and diarrhea, and through the lungs, because the air that we exhale is humidified air, and through the skin, that is insensible loss of fluids. So we're going to talk further about dehydration, looking at the signs and symptoms of dehydration, the classification of dehydration, as well as the treatment of dehydration. So dehydration is a common body fluid disturbance encountered in the nursing of infants and children. So children are more susceptible to dehydration than adults, and this is because number one, children have got increased metabolism, and for these metabolic reactions to take place, there is need of water. They use up water. These reactions use up water, and children are highly active, so they tend to lose out a lot of fluids via insensible loss, such as sweat. And children, they've got a low immune system, therefore they're susceptible to infections. And one of the signs of infection is fever. So they're going to lose out fluids via insensible loss because of fever, that is as a result of infection. So children are more susceptible to dehydration than adults. And apart from that as well is that children have a higher body water content, therefore they require proportionally greater volumes of water for them to maintain proper fluid equilibrium in their bodies. Yes, so children are more susceptible to dehydration because of the stated, than adults because of the stated reasons. So it occurs when the total output of fluid exceeds the total intake, regardless of the underlying cause. Although dehydration can result from lack of oral intake, when you reduce your oral intake, especially in hot season, while you're constantly losing that fluid due to insensible loss like sweat, you need to increase your oral intake of water, or else the resultant can be dehydration. So although dehydration can result from lack of oral intake, especially in elevated environmental temperatures, it is usually due to abnormal losses, such as those that occur in vomiting or diarrhea. So the main component of vomit and diarrhea is water, hence it can lead to dehydration. When oral intake only partially compensates for the abnormal losses as those occurring following vomiting or diarrhea. Diabetic ketoacidosis and extensive burns can also lead to dehydration. So the way that how can diabetes lead to dehydration? So in diabetes there is increased glucose levels in blood, and there is lack or no insulin. And the primary function of insulin is to transport sugars into the cells. Now insulin is not available, therefore we've got increased levels of glucose in the blood when the body cells are in need of these sugars. And what happens is that in normal circumstances, what happens is as blood is traveling throughout the body, once it reaches the kidneys, there is filtration going on in the kidneys. Blood is going to be filtered, sugar is going to be filtered from the blood. And as as this component, as the process continues in the nephrons, there's a part in the nephron where sugar is supposed to be reabsorbed back in the blood vessels. But the thing is that in the blood vessels, there's already high levels of glucose. So there is the sugars or the glucose that was filtered will not be retained back in the blood vessels, because in the blood vessels there is already a high levels of glucose. So what will happen is that this glucose is now going to be lost in the urine, and this is what you're calling glycosuria. And because of this glucose in urine, there's going to be an osmotic diuresis, meaning the glucose is going to pull water and fluids. So you're going to find that there's going to be increased urination. This can lead to what? To dehydration. So that is how dehydration comes about in diabetic ketoacidosis. And in terms of extensive burns, for in extensive burns, that means it's third-degree burns. The epidermis the epidermis are involved, and then the primary function of the skin act as a barrier to water loss. Now the skin has been lost, meaning water can easily be lost through the wounds. And apart from that, the blood vessels, they are also destroyed, and they become highly permeable. So which means water is going to move from the intravascular into the extravascular space. That will lead to dehydration. Therefore, we're going to have low levels of water in the vessels and increased amount of water outside the vessels, which is the interstitial space. And that is also what dehydration, that is edema, but also dehydration, because we've got decreased amount of fluids inside the blood vessels, due to the shift as the blood vessels have become more permeable to fluid. So there's going to be a fluid shift from the intravascular space to the extravascular space. So dehydration, to define dehydration is a deficiency of body water and occurs when the body's output of water is greater than the intake. Water turnover rate, the body weight in children, is 3 or more times than in adults. Excessive losses deplete the body stores of children quite rapidly. If water intake cannot keep up with the water loss, dehydration becomes more severe. So severe dehydration results in volume depletion, progressing to circulatory collapse, shock, and even death. And even death if emergency treatment is not begun. In addition to losing water, the child will lose electrolytes and other solids with the water. So there's not only a fluid shift, but there's also electrolyte shift that is going on in dehydration. Sodium is the main solid lost. Other losses depend on the source of water, on the source of fluid loss. For example, losses from the stomach, as with severe vomiting, include hydrogen and chloride. And hydrogen and chloride, these are the components that make up hydrochloric acid that is found in in the stomach. Losses from the colon, as with diarrhea, include relatively less hydrogen and more of potassium and sodium. So the loss of electrolyte will depend from where the fluid loss is occurring. And then the main organs that are affected by dehydration are the brain and the kidneys. So brain and renal cells are among the most susceptible to dehydration. When for urine to be produced, the high component there is water. So the kidneys will no longer produce large amount of urine, because the body literally doesn't have enough water. So the body is trying to conserve the little water that it has. So the result that is going to be reduced urine output. And then when it comes to dehydration, the brain cells are going to be deprived of water, which it will need for its survival. Therefore, you can have central nervous disturbances such as mental confusion, coma, irritability, restlessness, and the like. So those are the main organs that are actually affected in terms of dehydration. And then the classification of dehydration, we've got isotonic, and hyponatremic. Hyponatremic is this is supposed to be isonatremic. Sorry about that. So isonatremic, this is like natremic, this is involving sodium. So like we mentioned earlier, that in dehydration, sodium is the main electrolyte that is lost. So what is happening when there is isotonic and isonatremic dehydration? It occurs when the fluid loss is similar in sodium concentration to the blood. So you need to know that the body there is intravascular and extravascular fluid. Intravascular fluid is fluid in the blood vessels. Extravascular fluid is fluid outside the blood vessels. So when here it's saying it occurs when fluid loss is similar in sodium concentration to the blood. So what they're saying is that the water or the fluid that is going to move from the blood vessels to the outside of the blood vessels, it's got the same component. It has the same concentration of sodium. You need to think of sodium as an electrolyte that pulls water. So where sodium is, water is going to go there. So when the fluid that has been lost, the fluid that is moving from the blood vessels going outside the blood vessels, it has the same component of sodium that has it has the same component of the sodium that has remained in the blood vessels. Okay, let me give an example. If the water that is being lost from the blood vessels going to the outside of the blood vessels has got 45% of sodium, even the sodium that has remained in the blood vessels, it is 45%. So there is not going to be any pool of water, because the sodium outside the blood vessels and the sodium inside the blood vessels, it is at the same concentration. So no wonder, so sodium and water losses are of the same relative magnitude in both the intravascular and extravascular fluid compartment. So the fluid that is leaving the blood vessels, it has the same concentration of sodium and water as the sodium and as the fluid that is in the water in the blood vessels, right? So isotonic. No wonder the dehydration is what? It is mild. The fluid that is leaving the blood vessels has got the same concentration of sodium and water as the fluid that is in the water in the blood vessels. Therefore, there is no fluid shifting going on here. Therefore, the condition is what? Is mild. So that is on isotonic and isonatremic dehydration. That's supposed to be isonatremic, not hyponatremic. Sorry for that. Um, and then the second classification is hypotonic and hyponatremic dehydration. It occurs when the lost fluid contains more sodium than the blood. So in this case, we're thinking about like 75% of the fluid leaving the blood vessels has got what is has got, or let me say, the fluid leaving the blood vessels got like 75% of sodium, while the fluid that has remained in the blood vessels has got what? 15% of sodium. So what is going to happen? Which side has got more sodium? It is the outside. So what is going to happen is that so relatively more sodium than water is lost, because serum sodium is low, which means the sodium in the blood vessels is low. Intravascular water shifts to the what? To the extravascular space, because it's like the extravascular space has got more solute, therefore it is going to pull water, like the sodium, which is a lot from the outside of the blood vessels, is going to pull water from the blood vessels. So we've got fluid shifting for water shifting from the what? From the intravascular space to the extravascular space. Why? Because the extravascular space has got more solid sodium. The fluid that is outside has got more sodium than the fluid that is inside the blood vessels. So I'm going to read this again. It occurs when the lost fluid contains more sodium than the blood, relatively more sodium than water is lost, right? Because of this, because the serum sodium is low, intravascular water shifts to extravascular space, because like I said, sodium is it pulls water. So because sodium is a lot outside the blood vessels, this fluid outside the blood vessels, the sodium is going to pull the water from the blood vessels to the outside. So we have more water outside than what? Than inside the blood vessels. Exaggerating intravascular volume depletion for a given amount of total body water loss. So what is happening in this condition is that we have more water outside the blood vessels, and we've got little water inside the blood vessels. So this is what we are calling edema. This is what we're calling edema. We've got more fluid outside the blood vessels and little water or little fluid inside the blood vessels. And because of this is what we're calling edema. And so no, and then the condition is going to be moderate. This is leading to moderate dehydration. Then we've got hypertonic and hypernatremic dehydration. So it occurs when the lost fluid contains less sodium than the blood loss. So in this case, we've got the opposite. Inside the blood vessels, we've got more sodium than the outside. So what is going to happen? The blood vessels are going to pull in more water to the inside, because the sodium in there it is higher than the sodium outside of it. So as we know, sodium it pulls water, so more water is going to be put inside the water, inside the blood vessels. So here, relatively less sodium than water is lost, because the serum sodium is high. extravascular water shifts to the intravascular space, minimizing intravascular volume depletion for a given amount of total body water loss. And the resultant is going to be what? Severe dehydration. Severe dehydration. So remember the three components of the three fluid components. We've got um, extracellular and intracellular what? Intracellular fluid. So extracellular fluid contains the blood, the plasma, and the interstitial. So when we say extravascular, we are meaning the fluid inside the cells. So intravascular, this is the fluid. Intravascular is fluid inside the cell. Extravascular is fluid outside the cell, and the fluid outside the cell is part of the intracellular fluid compartment. Yes. So those are the classifications of dehydration. I hope it's clear. I've got isotonic, where sodium inside the blood vessels and outside the blood vessels is of the same concentration. Therefore, there is no fluid shift. We've got hypotonic and hyponatremic dehydration. And because of this, the resultant is going to be more dehydration. And here we've got more sodium outside the blood vessels and little sodium inside the blood vessels. Hence, the more water is going to be, there's going to be water, there's going to be a fluid shift from the intravascular to the extravascular, because the extravascular space has got water, has got more sodium than the inside of the blood vessels. Therefore, the condition is going to be, this is going to lead to moderate dehydration. Then we've got hypertonic or hypernatremic dehydration, where the inside of the blood vessels have got more sodium than the outside. Hence, the inside of the blood vessels are going to put in more water in the inside of the blood vessels. Hence, we have severe dehydration. So dehydration can also be in terms of like we are mentioning, mild, moderate, and severe. So no dehydration. What is the clinical diagnosis of no dehydration? When loss of less than 5% of total body fluids, and there are no enough signs to classify as whether some or severe dehydration. Then you can classify that dehydration as the no dehydration. And then when you have loss of water loss of water of 10% body weight, total body fluid, then we have any two of the following signs: restlessness, sunken eyes, skin pinch goes back slowly. If we have any two of these signs and we've got 10% loss of total body fluid, then you can classify that dehydration as what? As some dehydration or moderate dehydration. Then if we have loss of body fluids more than 15% or more, and any two of the following signs like lethargic or unconsciousness, sunken eyes, skin pinch goes back very slowly, then we can classify that dehydration as severe dehydration. I hope we're together at this moment. And then the signs and symptoms of dehydration. So here is a table to illustrate the signs and symptoms of dehydration according to their severity, with a mild, moderate, or severe dehydration. So when you look at the percentage of body weight loss as water in infants, when it comes to infants, in mild dehydration, you're going to lose about 5% of body water or body fluid. In moderate dehydration, infants are going to lose 10% of body fluid, while in severe dehydration, infants are going to lose about 15% of fluids. In older children and adults, in mild dehydration, we're going to have a loss of body fluid about 3%, in moderate 6%, while in severe 9%. When it comes to blood pressure, in mild dehydration, the blood pressure is normal. In moderate dehydration, the blood pressure can be normal to low. What determines the blood pressure is the blood volume. So when the blood volume is high, so in blood pressure, when it comes to severe dehydration, the blood pressure is actually low. because we've got a lot of water, we've got an increased blood volume. Therefore, the rate at which blood will be moving is going to be very low. And then when it comes to pulse, in mild dehydration, we've got a rapid pulse. And then in moderate dehydration, we also have a rapid pulse. And then in severe dehydration, we've got a rapid to weak pulse. Pulse here now indicates of the heart rate. In indicates of heart rate. So the heart is going to be pumping, it's going to be beating very fast in order to compensate for the, because it needs to supply the whole body, the rest part of the body with blood. Now because the blood volume has decreased, so it's going to increase its workforce so that it can compensate for the low blood volume. And then we've got eyeball, which is going to be normal in mild dehydration, going to be sunken in moderate dehydration, as well as in severe dehydration. When it comes to the fontanelle, it's going to be normal in mild dehydration. It's going to be sunken in moderate dehydration, as well as in severe dehydration. When it comes to the tears, where water is the main component of tears, it's going to be normal in mild dehydration, absent in moderate dehydration, as well as in severe dehydration. When it comes to the mucous membrane, they're going to be dry in mild dehydration, as well as in moderate dehydration, but in severe dehydration, the mucous membrane are going to be parched. And when it comes to skin turgor, it's going to decrease mildly in mild dehydration, while it's going to be tenting in moderate dehydration, and it's going to indicate severe disease in severe dehydration, meaning the skin turgor is very, it has decreased to the core. And then when it comes to behaviors, because like we said, that the brain is one of the most affected organ when it comes to dehydration. So in mild dehydration, we're going to have normal behavior, but in moderate dehydration, we're going to have irritability and restlessness, while in severe dehydration, we're going to have lethargy or unconsciousness. So what are the signs and symptoms of dehydration? You can talk about loss of body fluid, um, decreased blood pressure, increased pulse rate, sunken eyes, sunken fontanelle, decreased production of tears, dry mucous membrane, decreased skin turgor, and irritability or lethargy or unconsciousness. So those are some of the signs and symptoms of dehydration. And then when it comes to the treatment of dehydration has been phased out in Plan A, Plan B, as well as Plan C. Plan A corresponds to mild or no dehydration. Plan B corresponds to moderate dehydration, while Plan C corresponds to severe dehydration. So the way you treat mild dehydration is as follows, because when it comes to a child, so this is both for children and adults. So certain things, when you're going to give Plan A to an adult, you're going to remove certain things like breastfeeding. Obviously, adults don't breastfeed. So when it comes to Plan A, which will treat for mild or no dehydration, you ask the mother to continue breastfeeding, because breast milk is going to be it's like the major source of water for the child. So you're going to have ask the mother to continue breastfeeding, and then teach and show the mother how to make oral rehydration therapy, ORS. You need to teach them how to correctly make this solution. Then give child ORS instead of water. Then if it's up to 2 years, you give the ORS, you give 50 to 100 mils after each low stool. And then if it's 2 years or more, you give 100 to 200 mils after each loose stool. And then you also give extra fluid until the diarrhea stops, because what you're trying to do is that you're trying to replace the lost fluid that is in the loose stool. And then give zinc sulfate 10 to 20 milligrams orally once a day for 7 days. And what zinc sulfate does, that it increases the the GI reabsorption of fluids and micronutrients. And then you can also ask the mother to go back home, because you're not going to admit child, as you know, this is a mild dehydration. So you ask the mother to go back home. Then tell the mother the danger signs such as blood in stool. Blood in stool is going to indicate maybe a perforation in the what, in the GIT. And one of the danger signs is avoidance of feeding. If the child is refusing to eat, like I mentioned earlier, that we tend to supply the body with fluids through the food and the drinks that we take in. So if the child is refusing to take in food, meaning they're going to they're not replacing, excuse me, they're not replacing the fluid that is being lost. So you need to come back to the health facility because this is a danger sign. Then for plan B, which is where you're treating for moderate dehydration, copy and paste plan A treatment. And then on top of that, you're going to admit the child for observations and continued treatment. So when you're writing, you're not going to say copy and paste plan A treatment. No, you're actually going to write down everything that is under plan A treatment, but add this admission of child, because in plan A we're saying ask the mother to go back home, but in plan B you're going to admit child for observations and continue treatment. And then for plan C, dehydration, for plan C, where you're treating for severe dehydration, the first thing you're going to do is resuscitate. Like we say that if you're going to classify a clinical diagnosis of severe dehydration, there's supposed to be a symptom of lethargy or unconscious. So the child or the person is coming and in an unconscious state. So the first thing that you're going to do is resuscitate. And how you're going to resuscitate, we're going to follow the ABC, the ABC uh, route or channel. Yeah. So the first thing that you're going to do is position child in recovery position to allow a full lung expansion and easy drainage of secretions. What else you're going to also sanction if there are any secretions for effective breathing, and then you're going to set up IV lines for commencement of fluid. So in a child less than 1 year, you are going to give 30 ml per kg body weight in 1 hour, then 30 ml per kg body weight in the next 5 hours. And then if it's a child more 1 year or more, if it's a person 1 year, if it's a person aged more than 1 year, you are going to give 30 ml per kg body weight in 30 minutes, then 30 ml per kg body weight in the next 2.5 hours. And then administer some humidified oxygen, 1 to 2 ml per minute to combat tissue hypoxia. This is in children, but if it's an adult, you are going to give 4 to 5 ml per minute to combat of oxygen, humidified oxygen, to combat tissue hypoxia. Insert an NG tube for expressed feeding, because this person is coming in an unconscious state, hence they will not be able to feed on their own. So you insert an NG tube for expressed feeding. Like we said, we tend to supply the body with fluid through the food that we also take in. And then loose any tight clothing in order to allow adequate blood circulation and keep the child or the person warm, so that we prevent heat loss. So that just keep the child warm. And then give ORS. Give ORS on keeping the child warm when the child is shivering. When the child is cold and they start shivering, when the person is shivering, there's increased metabolism and to give off energy, and there's also insensible loss that will lead to insensible loss as well. Then give ORS about 5 ml per kg per hour as soon as the child is able to drink. And then give zinc sulfate. Like we said, zinc sulfate, it increases the reabsorption of fluids and macronutrients. Then resume breastfeeding and other feeds of the child. That is how you treat severe dehydration. So that is all on dehydration. And we say that dehydration is an imbalance between the fluid input and the fluid output. We have a fluid output higher than the fluid input. And then we talked about the classification where we had isotonic, hypotonic, and hypertonic dehydration. In isotonic, we have In isotonic, we have sodium levels. The sodium that is lost in fluids is of the same concentration as the sodium that is in the blood vessels. Therefore, there is no shifting of fluids here. And then in hypotonic, rather, we've got a high concentration of sodium in the lost fluid than in the blood vessel. Therefore, we've got the water shifting from the intravascular to the what? To the extravascular, because sodium pulls water, regardless of which side it's on. And then on hypertonic dehydration, we've got more sodium inside the blood vessels. Hence, the blood is going to be pushed from the extravascular to the intravascular space. And then we talked about the signs and symptoms, where we had low blood pressure, high pulse rate, sunken eyes, sunken fontanelles, irritability or lethargy or restlessness. And yeah, so those are some of the signs and symptoms of and decreased urine output as well. Those are some of the signs and symptoms of dehydration. Then we talked about treatment. We talked about plan A treatment, Plan B treatment, and Plan C. Plan A corresponding to which treats the mild dehydration, Plan C, which treats the Plan B, which treats moderate dehydration, and Plan C, which treats the severe dehydration. So I hope you found this session helpful. And this is Miss Kanyambo from Grace Nutrition Center. So we are going to see or commit in the next session. Thank you for joining us.